Speaking today is Dan Cooperstein, Senior Vice President of Compliance, Dot Summers, Senior Compliance Consultant, and Benefits Advisor John Crable, Senior Vice President of Corporate Synergies. Turning over to you, Dan.
Great. Thank you, Heather, and thank you all for joining us today for our coronavirus update and discussion of benefit strategies during a pandemic. I'm Dan Cooperstein.
And I'm Dot Summers.
And I'm John Crable.
Great. And I am really honored today to really have two benefits experts in addition to myself on the phone today, on the line today with me. Dorothy Summers is Senior Compliance Consultant on our team at Corporate Synergies, brings over 20 years of experience as a consultant specializing in health and welfare plan compliance strategies, helping clients of all shapes and sizes identify areas that they can identifying areas of non-compliance, helping them out with ERISA, COBRA, HIPAA, privacy and security matters. Myself, I'm an attorney with about 15 years of experience specializing in ERISA, employee benefits, and executive compensation matters. I specialize in ERISA, obviously all matters involving health and welfare plans, and representing both plan sponsors, employers, and health plans as well. And then we also have with us today as a special guest presenter in our compliance update series, John Crable, who is a broker and benefits consultant with Corporate Synergies. He brings over 25 years of experience assisting private and public sector companies, nonprofits and associations and other types of plan sponsors, really specializing in the design, negotiation, implementation, and servicing of their health and welfare plans and insurance arrangements. He really brings a lot of expertise in claims issues and claims impact, dealing with carriers and things like that. And so, while we'll do our normal thing today of Dot and I discussing many of the regulatory and compliance implications of the global coronavirus pandemic, John is going to be weighing in and discussing, how the insurance carriers are responding to this, how this may impact your claims cost, and other, brokerage and insurance questions that you may be asking at this time and during this crisis. So with that being said, we are not presenting live today in front of a studio audience in Camden, New Jersey, in light of the coronavirus pandemic, but we are with you from our homes during this crisis. And so let's go ahead and get started and kind of discuss, kind of how we got here a little bit. And I know many of you, watch the news, so we're not going to go into a lot of detail here, but I just had a few slides here in the beginning. I wanted to talk about from the middle of March that really kind of give you a sense as to the scope of this pandemic and its likely impact on the U.S. I think there's been a lot of, in the last few days especially, there's been a lot of discussions in the news and during the White House press briefings about, how many people could this impact in the U.S. I think the number is somewhere, based on everything I've been reading, is somewhere between 100,000 to 240,000 people in the U.S. could die from this pandemic. These slides already, we had this information here on this slide and on the next slide and the next couple of slides really from middle of March. We knew that this was going to have a big impact. Here's a slide showing also from the middle of March, just kind of showing how the Dow dropped to its lowest level since 2017 on March 16th. So this obviously is going to have very large ripple effects through the economy. And we are going to be discussing a little bit of, some of the related economic impacts of these of the pandemic today, in ways you can protect your plans in light of that. And then this next slide here, which discusses, which is from the Kaiser Family Foundation research, shows that even in the middle of March, right, we knew that there were more than 100 million U.S. adults that were at very high risk if they became infected with coronavirus because of pre-existing conditions and serious illnesses that they had prior to the outbreak. So obviously, we knew that this thing was going to have a very big impact, and it's really going to lead to a lot of changes in rules, regulations, insurance, healthcare, and so that's why we wanted to put together today's special webinar for you and to help you, respond in this time. So, Dot, with that being said, you want to give us an overview of the agenda and what we'll be talking about today?
Sure. So, the main thing that we'll be talking about is the significant developments pertaining to coronavirus and its impact on your health and welfare plans. We're going to review, some of the new paid leave laws and some of the other laws that, do apply to group health plans. We're going to also give you an overview refresher of key laws and regulations to help you understand how the pandemics can impact your benefits plans. And then we're going to give you key takeaways and action steps for you to take back for, in dealing with any health emergency or any other possible related recession.
Great, thanks, Dot. And like I said before, we're not going to go through all of these details about how this thing started, but I think, as you probably all know at this point, right, beginning in December, or some have said late November of 2019, reports of severe pneumonia of an unknown origin were coming out of China, and immediately Chinese officials did a shutdown of Wuhan, China. In the following weeks, they did identify this is a new type of coronavirus called coronavirus. Later became identified as COVID-19, and really things kind of, not much really happened in the U.S. really for during this time period. And there were, of course, the Trump administration did restrict travel from China on January 31st. But really, from a legal and regulatory standpoint and a insurance standpoint, not much really happened necessarily until March 11th, and that was really when we kind of saw on that day, Wednesday, March 11th, the president. That was also the day the WHO declared a coronavirus a pandemic. The president blocked most visitors from continental Europe, with the exception of the UK, and really that's when we saw just a very big ramp up of legal and regulatory change, coming out of Washington and the states, and it was really on almost a scale we hadn't seen, not just since the ACA went into effect about 10 years ago, but really even arguably since World War II, or even you could say the Great Depression. I mean, this is just a massive amount of laws and regulations began to come out, really kind of beginning on that Wednesday, March 11th, till the present. And it's still ongoing. There's going to be another stimulus package. There's going to be more rules and regulations. So really, this is, we've mounted a very big response, and that's kind of what the focus is going to be on today. Is sort of how does this impact, your health plans? How does this impact, other related, benefits and insurance that you may be offering? And so, beginning on March 12th, we saw, really on March 11th, we saw the White House meet with major health insurance companies to talk about how they're going to respond. The major insurance companies agreed that they would offer the coronavirus testing at no charge. On March 12th, the U.S. House of Representatives began working on a relief measure, which we now know as the FFCRA, and Dot's going to be talking about that more later. New York City declared a state of emergency on March 12th, and on March 13th, the president declared that a national emergency, and said that they are working to, as quickly as they can, to relax the rules on telehealth and give the agencies more discretion to issue rules in light of the pandemic. And then that Saturday, we saw airport delays. We saw in at least 2 jurisdictions in the U.S. began to announce curfews, and the first deaths in New York were reported. And then on the 15th, we saw really just unprecedented statistics coming out of Italy, with just it's hard to imagine numbers. Numbers of over 1,800 people dead, as reported by the Associated Press, and the numbers of over 350 people dying in a day, just very scary reports coming out of Italy. At this time, the middle of March, the U.S. had almost 3,000 cases, 59 reported deaths, and really the New York Governor Cuomo really kind of was really in this region really pushing to do something, and was working on coming up with some kind of solution, at least at the New York level. And then on the 16th, more closings and curfews. New York City closed its public schools, and the Dow plunged more than 2,000 points at the open. So those were very big developments. Then on the 18th of March, Congress passed the FFCRA, which Dot will be talking about in more detail later. March 20th through the 28th, the agencies just released a tremendous amount of new guidance and rules about compliance obligations of health and welfare plans. And then on Friday, March 27th, the President signed the CARES Act into law, which is the largest stimulus package in the nation's history, providing much-needed relief to individuals, businesses, and several hard-hit industries. So just a lot of things happening kind of all in a one-week time period, really, 2-week time period, I guess you could say, from a legal and regulatory standpoint. So let's talk a little bit about some of the things that that happened in response to this, right? And one of the earlier things that happened was that the IRS issued really early on made the decision to allow high deductible health plans to pay for treatment of COVID-19 as well as the cost of testing for COVID-19. All of those costs could be paid for below the required minimum annual deductible on a high deductible health plan, and the IRS said you could still maintain a qualified high deductible health plan, which means that employees could continue to contribute to their HSAs, their health savings accounts, on a pre-tax basis. So this was very important for plan sponsors and participants as it opened the door, for more and more employees to feel comfortable that these costs for both the testing and the treatment could be considered to be not applied toward the deductible, but it should be noted that this guidance merely gave plans the flexibility to offer this type of arrangement. It did not actually require that all high deductible health plans, change their plan, amend their plan to make it so that all of these costs would not apply to the deductible. So it's an important thing to be aware of. So as a plan sponsor, right, you don't have to make your high deductible health plan this way, but you can if you want. It's kind of the basic takeaway from this. And also it's our understanding that some claims administrators appear to have been waiving cost sharing for all telemedicine, for all types of things, all kinds of coronavirus treatment on the high deductible health plan, but of course waiving all that cost sharing initially without making sure that it complied with the terms of your plan could still potentially result in disqualifying the high deductible health plan. So just something to be aware of. You want to make sure that if you are going to make this change, that it's documented and the plan is amended and as soon as possible. And do you want to talk about? I'll talk about some of the other agency guidances after this, but we're kind of going in order a little bit of how things happened. So Dot, do you want to talk about the Families First, the FFCRA, and we'll go from there.
Sure. Thanks, Dan. So as Dan said, on March 18th, the Family First Coronavirus Response Act, FFCRA, was passed. That law dealt with, a couple of items that I'm going to talk about. Dan did kind of talk a little bit about this, that this original piece of this law does permit health insurance issuers and group health plans, including telehealth plans, to provide free coronavirus or COVID testing. So again, outside of the deductible, is a part of that. But if somebody is going for testing, that the cost for that will be free. With regard to that testing, they do not distinguish between fully insured and self-insured plans, nor do they deal with in-network or out-of-network coverage. And as Dan said, this first piece of the FFCRA is for free no cost for the testing. So the original law, again, does not necessarily cover then at no cost for treatment once somebody is tested and diagnosed. But again, what Dan was saying is, recently over the last couple weeks, some carriers, again, are changing their plan specifically. Cigna and Humana have made the decision to waive all out-of-pocket costs for those that need treatment for COVID-19. Those plans specifically will have that in for free cost from now through May 31st. And one of the main reasons, and some of the things that I saw that those carriers were saying is that that they really don't want these individuals to have surprise billing. They don't want them to have disputes over payments or concerns about doctors being out of network, because they don't want to have people not seek care because of this, having these financial burdens and that. So again, good news for, that certain carriers are doing that. Again, not all carriers. And again, we're not sure how that, if those groups choose to do that for an HSA plan, how that could affect the employer's compliance with that regulation. All right. The second really major piece of the FFCRA deals with paid leaves. And, with all of these organizations and businesses and companies with, people not being able to work and having to be in quarantine and taking care of sick family members, they really wanted to ensure that this type of displaced employee who, hands were really tied as far as being able to work, they wanted to come up with some laws. So they came up with these paid leave provisions. There are two of them. The first one is the emergency paid sick leave, or the EPSLA. As I talk about that, I'm going to refer to that as the paid sick leave. And then they also have the Emergency Family and Medical Leave Expansion Act, and that I will refer to as paid family leave. Both of these laws go into effect today, and they will end on December 31st, 2020. A little bit different in how they're designing how these different laws apply to different employers. They basically have set the employee count at under 500 employees, so it's private sector employers with under 500 employees. Usually in regulations, it's how many employees, so many, working for you for so many days in the previous calendar year. None of that is a part of this. They really started from scratch here. So it's private sector employers under 500 employees. That determination is made at the time of the employee's leave. The employer must count employees in the United States, DC, and U.S. territories. The employees that you're counting are full-time employees, part-time employees, employees that are on existing leave, temporary employees who may you might be jointly employed by two different employers, and also day labor supplied by a temporary agency. So if you have temporary agency employees working for you, you may still have to count them. Employers with less than 50 employees may elect to request and be approved for a small business exemption. And what they're looking at here is that if a smaller group, less than 50, if it would jeopardize the viability of their business to have to be paying out this leave, they could qualify for a business exemption. The other main piece, and there was a lot of questions, was, well, what if, yes, it's less than 50 employees. Well, what if I'm an employer and I have my owner owns 3 other companies? Do we look at, is this less than 500 based on individual EINs? Is it, common control like we do with, Internal Revenue Code Section 414 when we're making determinations about control groups and sister companies? So the DOL has clarified that when determining which entities should be counted together, they're using the integrated employer test, which comes from the current FMLA regulations. And some of the things that they're looking at to determine if 2 or more entities are related, they're looking at common management, They're looking at interrelation between operations, centralized control of labor relations, and a degree of common ownership or financial control. So, this is real important. If you do have multiple entities, this is definitely something that, you would want to have your legal counsel, review as far as, make that determination on, is there that common management, centralized control, etc. All right. So let's first
before you move on, just
sure.
one thing to add to that is that they also, to the extent that you are jointly employing, you're working with another entity that, whether it's commonly controlled or not, the DOL also said, to the extent that you're jointly employing employees, they will also be looking at the joint employer standards released under the Fair Labor Standards Act. And, a lot of those factors and determinations are the same as what Dot mentioned, but I just wanted to clarify that as well.
Thanks, Dan.
Yeah.
Okay. Yep. So let's talk now about the first paid leave that I mentioned, and that's the sick pay leave. This is eligible. All employees are eligible, regardless of the length of employment or the number of hours. You could be working for a company for 10 years, be eligible for it. You could be working for a company for the last 3 weeks and still be eligible. Interesting thing here is that covered employers may choose to elect to exclude healthcare providers and emergency responders. When the law first came out, we weren't really sure what that meant. Healthcare providers, there was a definition in the original FMLA law that had more to do with what type of healthcare provider could certify that the individual had a serious health condition in order to qualify for FMLA. But the DOL has clarified that term healthcare provider to mean anyone employed at any doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, medical school, local health department or agency, nursing facility, retirement facility, nursing home, healthcare provider, any facility that performs laboratory or medical testing, pharmacy, or any similar institution, employer, or entity. And then obviously emergency responders, again, those dealing, EMTs and the like. All right, so the sick pay leave allows for 2 weeks, 10 work days for specific coronavirus-related issues. And there are 6 qualifiers to qualify for this. The first is that the employee is subject to a federal, state, or local quarantine or isolation order related to COVID. That does not necessarily, is not meaning a shelter-at-home order from a specific governor. If, again, this is not a shelter at home for the next 2 months is not the same thing as a quarantine or isolation order related to COVID-19. The second is you are advised by a healthcare provider to self-quarantine. You're starting to have symptoms. You've contacted your primary care physician. They're not, exactly able to diagnose you with or without it. They're saying to you, you know what, it sounds like it. You're having the symptoms. You should, you should self-quarantine yourself. Similar to that, the third, experiencing symptoms and seeking a medical diagnosis. Again, either through an urgent care, your primary care physician, through telehealth. The fourth eligibility is that you're caring for an individual, not just necessarily family, but you're caring for an individual subject to a federal, state, or local quarantine or isolation order or advised by a healthcare provider to self-quarantine due to COVID-19 concerns. And additionally, caring for children if the school or place of care is closed or the child's care provider is unable due to public health emergencies. And then the final, we're getting a lot of questions about this, is experiencing any other substantially similar conditions specified by the Secretary of HHS, Treasury of Labor. So, as far as I'm aware, no additional conditions, similar conditions have really been added to this. So this isn't just, I'm starting to have symptoms. And Dan, you might want to jump in, just confirm here. But I think what this does, though, is this allows the agencies, if something else manifests or there is a different type of virus that is similar to COVID-19, that this does allow the agencies to then apply these rules kind of to that definition, to that condition that the agencies may issue at a later date.
Agreed. Yeah, I think that's a good point. I mean, we still have a long way to go here, and the agencies want to kind of give themselves the flexibility to issue later rules, particularly if something else happens that even relevant to this, if there's a vaccine or if there's another strain or there's something else that we don't know about yet. There's a lot of things that we don't know yet still. So I think that's an important point.
Okay. All right. So let's talk about how much sick paid leave an individual is eligible for. So for full-time employees, they're eligible for up to 80 hours of maximum of regular pay over the first 2 weeks of the FFCRA period. For part-time employees, it's the average number of hours the employee works over a 2-week period. If you have part-time variable hour employees and their schedules vary, and the employer may use a 6-month average, or if the employment is less than 6 months and they have that variable hour schedule, then you are able to use the number of hours agreed upon at hire. Payment is based on the employee's full rate of pay. It is capped at $511 per day, or aggregate of $5,110, and that is for taking reasons to care for themselves. So remember those 6 items I talked to you on the last slide. This $511 per day would apply to if the employee themselves was subject to a quarantine, the employee themselves was advised by a healthcare provider, or that they were experiencing COVID-19 symptoms. If you are taking this leave to care for someone else, then the payment is different. It is based on 2/3 of the employee's full rate of pay, capped at $200 per day, or $2,000 in the aggregate. And to understand here is that an employer cannot require an employee to use their PTO or sick time in lieu of paying them this benefit. All right, so that was the sick paid leave. Let's talk about the paid family leave. So essentially this is an extension of the current FMLA law, but what it does is it expands it by one, allowing the only condition that an employee to be eligible for has to be employed for at least 30 days with the employer, unlike the original FMLA law with the 1,250 hours within a year. And what the expansion does, though, is it's adding one additional reason or qualifying reason to take this leave, and that qualifying reason is that the employee is unable to work or telework due to care for a child under 18 years of age if the school or place of care has been closed, or if the child care provider is unavailable due to public health emergencies. This law is not saying, and this expansion is not saying, that if someone is on FMLA for any other reason, maybe they recently had surgery and they're out on leave for that. This is not saying that then that becomes a paid leave and extension. This expansion deals specifically for that one reason. It is the same maximum amount of time as the current FMLA. It is 12 weeks within a 12-month period. The first 2 weeks or first 10 workdays of the 12 weeks is unpaid, but during that time, employees may substitute any accrued vacation leave, or they may also qualify for the paid sick leave that I just spoke about. So, the thinking is, okay, you have 12 weeks of the paid family leave. The first 2 weeks would be paid either through vacation, PTO, or maybe the employer has their own paid sick leave, or that individual could qualify for the emergency sick leave. And then the additional 10 weeks would be payable under this leave. That payment is from the week 3 to 12 is based on 2/3 of the employee's regular rate of pay capped at $200 per day for 10 weeks or $10,000 in aggregate. The other question that we are getting a lot is, is this 12 weeks in addition to the current FMLA 12 weeks? Now, the regulations in the DOL has clarified that it is not intended to add to FMLA, but it is a maximum of 12 weeks. So if someone previously has used 8 weeks of FMLA and now they need to apply and qualify for this, the additional amount that they would get is just 4 weeks additional leave. Okay. How do employees get paid for this? So the employer is responsible for paying the wages for both the paid sick leave as well as the paid family leave, but to kind of help alleviate the extra, expense to the employees, the FFCRA does allow an employer who pay for qualifying sick and child care leave to apply for or be able to have a federal credit. And the way that that works is that the covered employees who pay qualifying sick or child care leave will be able to retain an amount of the payroll taxes equal to the amount of qualifying sick and child care leave that they paid rather than deposit that into with the IRS. So basically, employers are required to, pay federal, state, FICA, and Medicare tax. So instead of making those quarterly tax payments, the employer is able to keep a portion of that amount. So, for example, if the payroll taxes available for retention include federal withheld income tax, the employee and employer share of Social Security and Medicare taxes, let's say for a quarter that those taxes are $8,000. You've paid out these paid benefits to your employees, and it comes, in the amount of $5,000. So for that quarter, instead of paying and depositing into your payroll tax account $8,000, you can keep the $5,000 for the paid leave, and then only deposit the $3,000. If your paid leave benefits are more than your payroll taxes, and they're insufficient, then there is a way for the employer to file a request for an accelerated payment from the IRS. The regulations are saying that the IRS expects that they would be able to process those requests, in 2 weeks or less. All right. Some interesting facts to think about, that to the extent that the employee is able to telework while caring for a child, they are not eligible for this law. If the employee is furloughed or laid off and there's no work for that employee to perform, they are also not eligible for paid leaves. But in contrast to that, if hours are reduced as a part of a furlough, and so instead of a complete no work, you're maybe reducing hours or reducing days of work, that individual may be able to still qualify for that. So this was the FFCRA rule, where if someone was furloughed or not, there was no work for them to perform, they weren't eligible. But if you look at the bottom of the screen, again, the new CARES Act that was recently passed did modify this, and it does say that employees who were laid off by an employer on or after March 1st, 2020 may potentially qualify for this paid leave if they are later rehired by the same employer. Unfortunately, though, layoff is an undefined term, and also to be eligible for the exception, the rehired employee must have worked for the employer for at least 30 of the last 60 days prior to the layoff. So that's the basics, information. Certainly lots of questions that are coming through. We're, getting a lot of this information. The DOL is putting out lots of clarifying FAQs. It's happening, basically every day. So, but that's pretty much the basics of that.
Great, thanks, Dot. So let me talk a little bit about some of the other agency guidance that came out. And there's just so much of it that we could probably do a whole nother webinar on it. And so I'm going to just go through this as quickly as I can. And And I think it's just important to understand that we've been providing a lot of really helpful e-alerts and guides to this. So, definitely if you want more information about any of these things, of course, we have a lot of this information in our e-alerts. Let's first start with telehealth and some of the HHS OCR guidance that came out. So really the Department of Health and Human Services really started, they were way ahead of the trend here with regard to the other agencies at least. They came out as early as February with bulletin guidance, kind of clarifying what the rules are under HIPAA for health plans and other covered entities about how they can disclose health plan information under HIPAA during a pandemic, during an outbreak like coronavirus, which at the time wasn't really, even a global pandemic yet. So it was really they were kind of watching this early, and they clarified, in this initial guidance that they did back in February that, basically there are certain things, HIPAA's, restrictions will remain in place, they said, for this outbreak. And, they clarified that under HIPAA, disclosures of identifiable health information or PHI for reasons other than treatment, payment, or healthcare operations generally require written authorizations, right, from the employee or individual participant who has, whose information that is. However, they noted that group health plan administrators are permitted to disclose health information without written authorization in 5 specific situations, which are, particularly relevant in connection with COVID. The first is that HIPAA permits disclosures of health information to public health authorities for the purpose of preventing or controlling a disease. So, for example, a plan administrator could disclose COVID-related information to the CDC or public health authorities. Plan administrators could disclose COVID-related health information to a foreign government if directed to do so by a public health authority that is acting in collaboration with the foreign government. Plan administrators can disclose COVID-related information to people who are at risk of contracting or spreading the disease. If another law, such as, for example, state law, permits such disclosure, and also HIPAA allows COVID-19 information to be disclosed to an individual's family and friends or other person involved in the individual's care, but when possible, the covered entity should get verbal permission from the plan participant. When that is not possible, however, disclosure is permitted if the plan administrator determines that it's in the best interest of the individual. So, always try if you can to get some kind of authorization or verbal permission if you can. Otherwise, it'll go to this best interest standard. And then finally, if a plan administrator determines in good faith that disclosure of the COVID-related information is necessary to prevent or lessen a serious or imminent threat to the health and safety of a person or the public at large, the information may be disclosed to a person or entity reasonably able to prevent or lessen that threat. So these 5 exceptions, though, have to be looked at in the context of the HIPAA rules, and particularly the HIPAA's what are called minimum necessary standards, which are the minimum necessary principle is that only the minimum amount of information may be disclosed to achieve the purpose of the disclosure. And also, employers should be aware that they could obtain sensitive health information outside of their role as group health plan administrators. For example, if an employee calls out from work because they're quarantined due to COVID diagnosis or exposure. So in those cases, HIPAA would generally not apply, but employers must still consider other state and federal privacy obligations when determining whether to disclose that information. And basically, it's just very important that you kind of keep these things in mind. Now, there was later guidance that came out in March that indicated that Department of Health and Human Services Office of Civil Rights, or OCR, was going to be relaxing the HIPAA enforcement rules and compliance obligations in light of the global pandemic, which was now a pandemic at this time, of course, and not just an outbreak, as I said earlier. So, there is going to be some flexibility in that regard. Also, with respect to telehealth and telehealth providers during the pandemic, also CMS issued very extensive guidance on how they're going to be relaxing those rules for purposes of Medicare plans. So really a lot going on. And then, we talked a little bit about the CARES Act earlier, but this thing was really a monumental thing that happened. It was the nation's largest stimulus package, coming in at over a 2.2 trillion price tag. Just something that's really so large it's even hard to comprehend. But it does a lot of different things. That it helped codify, clarify, and make changes to existing laws and regulations on health insurance plans. It allows for a number of different types of things to be covered under account-based plans, like relaxes the rules on over-the-counter medication. It expands the flexibility of telehealth. It codifies a lot of the guidance that I just talked about on telehealth. It makes rules that easier under retirement plans for individuals to withdraw information to withdraw funds from their retirement plans if they were diagnosed with this disease, or their other impacts of the disease have impacted their financial circumstances. And then for both health and retirement plans, it gives the U.S. Department of Labor the authority to extend compliance deadlines. We haven't seen them use that yet, but we'll continue to watch that. It also enables employers to provide certain student loan repayment benefits on a tax-free basis. It adds 13 weeks of unemployment insurance benefits to the state unemployment insurance laws, and an additional $600 per week through their unemployment insurance benefits checks, and also, of course, provides much-needed funds to individuals, small businesses through SBA loans, and to several sectors of the economy, including hospitals, healthcare, and other industries. So let's talk briefly about also some of the state laws, and there's just so much happening that like the last topic on the agency guidance. I could probably do we could probably do a whole other webinar on that. But this is a picture. If you go back, you can see this is a picture of Central Park before before the pandemic got worse, when they had just announced some of the social distancing requirements, and you can see people sitting far away from each other on benches in Central Park as a result of the quarantine order, or the stay-at-home order in New York. But what you don't see in this picture of New York is the tents, the large tents in Central Park to care for all of the individuals who are sick, which only happened more recently, unfortunately. But so let's talk a little bit about the state laws. Several different states created, and localities as well, created new laws to provide for leave under these circumstances. There's just so many of them that it's even difficult to even kind of do a quick summary. But let's talk about some of the big jurisdictions out there where our clients are. In California, early on in the pandemic, the California Employment Development Department expanded the availability of state disability insurance, voluntary disability, and paid family leave to employees who are unable to work due to having symptoms of being exposed. San Francisco, the city released rules explaining that employers can't require doctor's notes regarding coronavirus for taking sick days. In Colorado, they gave 4 days of paid sick leave. In New Jersey, the New Jersey Department of Labor issued very helpful guidance early on in the pandemic that clarified that employees can use family leave insurance, or FLI, to care for a family member who has coronavirus. In New York, the state issued a COVID-19 paid leave law. And later, New York City issued guidance clarifying that New York City sick leave could be used for coronavirus-related sickness. The state law provides, with some exceptions, up to 14 days of paid leave and job protection if the employee or their minor child is subject to a mandatory or precautionary order of quarantine or isolation, whether issued by the state of New York, the Department of Health, another government entity, or if, in the case of those things, they can't get those orders in the event that those orders can't be sent out to the employee's doctor could release sufficient evidence for that. That law went into effect on March 20th. Employees can begin to take that paid leave on the first day of disability when they're unable to perform their regular duties of employment. So a lot of things happen at the state level. We wouldn't have time to go through all of them, but really just a very huge response at the state and local level. And let's also talk a little bit about kind of what we're seeing now. So a lot of the slides we've shown you thus far kind of showed things kind of more in the middle of March, or late, mid to late March, and just in the last few days, right, we've just seen this huge spike up of claims, right? The symptoms started to appear. There was a Mardi Gras in Louisiana. There were people on beaches in Florida. Case loads have kind of gone up significantly. And now you can see kind of on this next slide here, this is what those tents look like in Central Park. it's sort of a now versus then photo of, this is, 100 years ago in 1918, there was a flu pandemic, and you could see people, before getting on trains were wearing masks, and, this might be our new normal, at least for the foreseeable future. More and more people will be wearing masks when they take public transportation or going into large group settings. And we don't know how long these tents will be in Central Park that you see on the left, but it really is definitely a new normal and a new situation. And in light of that, we expect there to be a lot of claims coming out of your health plans, in some cases over $35,000 for coronavirus treatment. And so in light of that, I would like to just bring John Crable into the discussion to kind of talk about what he's seeing from the carrier perspective and some of the claims brokerage considerations.
Thank you, Dan. So some of this is a repeat of what you've already heard from either Dot and Dan earlier in the presentation, covering testing for COVID-19 at 100%, promotion of telemedicine and other virtual visits, waiving member cost share for treatment of COVID-19 right now is being applied to certain fully insured plans, which Dot had mentioned. So if you're with Cigna, Humana, Aetna, or a variety of other fully insured carriers, then the carrier is going to waive the cost of that treatment. The challenge is that the president is on TV talking about this great benefit. It's being reported by other news agencies, but if you're a self-insured employer and you have Cigna or Aetna, you have the option to choose whether or not you're going to waive those co-pays because, of course, as the employer and the payer of the claims, you would also be responsible for any waived co-pays. So that can be a little bit of a maneuvering on your part as it relates to PR and how you communicate that out to your employees. The employee doesn't necessarily understand that your plan is self-funded. Or in the case, I have a case of one client that has Kaiser, Aetna fully insured, Aetna self-funded, so they now have to weigh whether or not they're going to have a portion of their employees that are having treatment covered at 100%, and then are they going to incur the costs to do that for the rest of their self-funded population. So these are all things you have to consider. There's also a lot of the carriers are waiving charges related to home delivery of medications, and they're allowing for early refills of maintenance medications. And that's so that people can, one, avoid having to go out to be in public, and also just to allow people to make sure that they have their medications and they don't run short on supply. So some of the things that we're seeing, and I think what happens here is, this is for certain carriers. We literally receive notifications multiple times a day from various insurance carriers on what they are allowing or not allowing. So I think it's important that if you're in one of these unusual situations, that you talk to your account manager, your consultant, or your broker to clarify what flexibility is being offered through your various insurance carriers. And this applies for both medical, dental, life, disability, etc. So some carriers are waiving the population change provision, meaning that if you have a big reduction in force, they're not re-rating your group at this time. You have several carriers that are waiving actively at work provisions. So I have some clients that have furloughed their employees, but they still want to keep them on benefits because, one, they're hoping that this is a short-term issue, and two, they don't want to leave the folks without coverage. Now, we know financially this is challenging for a lot of employers, but if this is something that you are considering, then you just want to talk to your insurance company and make sure that they are comfortable with covering non-actively at work employees. Some carriers are offering special midterm open enrollment, allowing previously waived employees. So in other words, if you were a January 1 enrollment, an employee waived coverage, you could offer a midterm special open enrollment and allow those employees that previously waived coverage to now hop on your plan to ensure that they have medical insurance. And we have been negotiating with some of our, on behalf of some of our clients, I should say, to allow more flexible payment terms. You have we have some very large clients that are in the retail business or are in other trades where they're either running at 20% or in some cases shut down completely. So they don't want to have their plans terminated because, again, the hope is that they're going to be hiring everyone or bringing, the plans live and online in 4 or 6 weeks. So we're trying to negotiate extended payment terms. So we've received a lot of questions around the cost impact of COVID-19. So really, it's very early to say what the true cost impact is going to be. I read an article today from a nonprofit organization that said that in the U.S., they anticipate the total cost impact to healthcare. So this is both what the government will pay, what the private sector will pay, and what people will pay out of pocket, of between $350 billion and $1.5 trillion. So that is a 4 or 5 times difference from the low estimate to the high estimate, which tells you just how difficult it is to peg the potential cost impact. We do know that carriers are covering the cost of testing at 100%, and we know that that cost impact is a little more quantifiable. It's about 0.1 to 0.4% of your total premiums. So not a huge impact there. The treatment for COVID-19 can be anywhere from just a simple office visit, a telemedicine visit of $50, to an inpatient stay with an ICU and ventilator that will go into the tens of thousands of dollars. One recent source estimated that if 10% of your population contracts COVID-19, that your plan costs will increase 1 to 3%. And some costs, you have to remember that although there are all these new costs related to COVID-19, that there's also a mitigation in other medical costs taking place right now. Elective surgeries are not taking place. People are not getting knee replacements. Non-emergent care is not happening at the same rate. So although you're incurring all this potential new costs related to COVID-19, your plan is equally not spending in areas where it used to. That may mean that 2020 could be a level out year. You're exchanging one cost for another. However, the person that needs the knee replacement is still going to get it, whether they get it at the end of 2020 or in 2021. So really, we're deferring the potential additional costs. Okay. Dan, I think this is you.
Great. Yep. So we talked about a lot about what's to come, right? I mean, what could happen next year? What are the predictions of a global recession? What is the economic impact of this global pandemic? And what does it mean? What do we have to do, right, for our benefit plans and our programs, right? We've been speaking with many of you out there, many of our clients about, what to do if you've had a furlough or if you're doing a layoff or temporary layoff or permanent layoff. And really given how much is still unknown in light of this black swan or unprecedented global event, we are going to take a lot of these things that a lot of these considerations and best practices guides and really do another webinar on just on that topic, because we all believe that it really deserves more of its own time to kind of go through and help you with. And so in light of that, we did include those slides here on sort of, economic downturn implications and impacts of pandemics with regard to your policies and plans and takeaways. But just in the interest of time and just, to give it the attention that it really deserves, we're going to go ahead and just skip right through that so that you can just see some of the most valuable resources that we have, where you can click on those links that we have, and they will take you to what we believe are going to be some of the most helpful things to point you in the right direction. And so with that said, I think really, most of the questions that we've seen, that Dot and I and our teams have seen, really that have come out of the immediate, in the last couple of weeks, are really answered by this link here at the bottom of this slide, here on slide 53, this paid leave FAQ guidance that really kind of clarifies it's a Department of Labor piece of guidance that, very well written, very plain English, very easy to understand, and just kind of explains most of the questions that employees and employers are asking right now about this new federal paid leave program that Dot talked about under the FFCRA. So I would highly encourage all of you listening and who would like to know more about paid leave to look at those FAQs. They're very well written, and they really answer most of the questions out there that we know at this time. And then there also is a link here at the top of the slide to the paid leave model notice. So that's definitely a helpful, this is the one that's for non-federal employees, government, non-government. There's also one for federal government employees, but this link is a helpful link to have as well. And then on this next slide, you can see some links to the guidance that we talked about during today's presentation, the high deductible health plan guidance on that the IRS released, as well as the HHS OCR HIPAA guidance about when you can disclose health information about an employee or participant on your plans. And finally, and last but not least, on our specific coronavirus resources, Corporate Synergies does have a coronavirus resource center. Dot, myself, and our team are regularly updating the content on that resource center. Obviously, as you know, this stuff is changing every day, it seems like, or at least every couple of days. So, we will explain when things have been updated on that page, but it's constantly changing, but it's really there for you to go and find resources and links to our e-alerts and other compliance guides that can help you understand how this is going to impact your benefit plans and programs. And finally, just some additional or general resources that we always recommend you check out. We do still have our compliance resource center that will continue to keep things updated with regard to COVID-19 related, non-pandemic related compliance developments, as well as our health and welfare compliance forum on social media that you could get at that LinkedIn link. And finally, to learn more about our next events and upcoming events, we have a link to our continuing education events, which I would encourage you all to check out. So. With all of that being said, we really want to thank you for joining us. Yeah.
Sorry, Dan, I just wanted to mention that I know there were a lot of questions coming through on the webinar. As was explained at the beginning, you could answer questions. All of those are recorded, and so we will be responding to each and every one of those, after the webinar.
Great, thanks, Dot. And I think it's just important also just to say, we're here for you. We understand this is a difficult time. Many of your employees, people may have already been terribly sickened by this terrible virus, and so we're here to do the best we can to help you with any questions and concerns that come up. And so definitely don't hesitate to reach out to your contact at Corporate Synergies, and we'll do whatever we can to help. Finally, here we have a link for your CE HR credits, and again, we thank you for joining us today, and we'll continue to work to keep you updated. Thank you.